Welcome to page 102 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The blood vessels, how do they carry blood to the heart, and how to describe them? Of course, the blood is pumped to the heart through a large aorta here, a huge artery. So it comes from the left ventricle into the larger arteries, which are quite elastic, because when this heart squeezes, the left ventricle squeezes, they need to expand slightly. And as they travel through the body, they become smaller to a medium size. And they are muscular. There are muscles in the walls of the arteries. These medium-sized arteries become or branch off to smaller arterioles. And they are also muscular as well, and they provide resistance to the flow. They can contract and expand to change your blood pressure, actually. If they can dilate to allow more blood through, and they can constrict to allow less blood through. Those are arterioles. And here's your arteriole right here. Now, the arteriole branches off to what are called capillaries. Capillaries. These are tiny blood vessels. And their walls are so thin that nutrients, gases, and fluids can leak into the surrounding tissues. They are released. And they can also bring carbon dioxide into their tissues. So this capillary network, this capillary bed, is so thin, and it's kind of hard to tell where the capillaries end and the veins begin. So these capillary beds lie inside of all of our tissues, and it's where the exchange of gases occur. Like I said, the walls are so thin that oxygen is able to leak out of these capillaries on the arterial side of the bed, and they begin to leak out, and it's used by the body tissues. The body uses this blood right here. It gets used up. The oxygen, O2, is used up. When that happens, the color of the blood actually changes from red to blue. And the blue blood with no oxygen and now filled with carbon dioxide, actually, is now taken back to the heart through these venules, small venules. And the venules meet together and merge into tributaries, which supply veins, which travel back to the heart. So from small venules to medium-sized veins to large veins, back to the heart. The blood will actually come into the right atrium here, then into the right ventricle, out through the pulmonary arteries to the lungs, etc., and then back in to the left ventricle of the heart, freshly oxygenated. The heart will squeeze, that blood will come out, and the process begins again. The vessels, the arteries and veins have a unique structure. Inside, they are lined with endothelium. Endothelium, endo means inner. This is the inner lining of an arterial. This is the inner lining of an artery. The endothelium, a very thin layer, which winds up being the layer, or the only layer possibly, the thin layer of the capillary. Recall that gases like O2, oxygen, can leak out and permeate into the interstitial space out of these capillaries. Here is the endothelium. Arteries have a smooth muscle layer, very thick in the case of this artery here, a muscle layer, and allows to squeeze and apply pressure and resistance to blood flow and close off those arteries if a certain area does not need any blood, in response to autonomic, sympathetic, or parasympathetic activity. And here is the muscular layer of an arterial. Now, the capillary does not have a muscular layer. It is just a layer of basically endothelium. And surrounding the outside is fibrous tissue, the outermost layer, for structure and toughness and elasticity. And of course, the fibrous tissue surrounding. And from this view here, from a cross-sectional view, and that's the arteries. Now the veins, there's a couple differences between arteries and veins. One, notice that the well, first of all, they have a thin endothelial layer as well, and they are also have an endothelial layer that winds up being a capillary for exchange of those gases and fluids and nutrients. Here's the endothelial layer, and what you'll notice about the endothelial layer is that it has these little valves in it, these sort of backflow valves that allows blood to travel this way through the vein. But if blood ever tries to go back that way, this vein will sort of snap and blood will not be allowed to go through this way. Let me do that correctly. There we go. Blood will not be able to backflow. And so there is a lumen, but what to notice about there is the very small and thin muscular layer. It's not prominent compared to the muscular layer of the artery, which is significant, and of the arterial, more significant. And here's an example of blood from a vein traveling back to the heart this way. And you can see this little valve here that if the blood were ever to fall backward, it would get caught or captured by this little valve. So the blood comes through and this valve will come from up and will snap shut if the blood tries to come backward. The venous flow is assisted by the contraction of muscles in your legs and arms and in your body. When they contract, they can kind of squeeze on the veins and help to boost the movement of the blood. And that is page 102 of Anatomy Coloring Book. This is Dr. Stephen Harkins.